Ovide Lotion is used to treat head lice, which are tiny insects that infest and irritate your scalp. The medication contains malathion, which belongs to a class of drugs known as organophosphates. It works by paralyzing and killing lice and their eggs, nits. It is important to note that this drug is not recommended for use in newborns or infants younger than 1 year. The recommended dosage and timing for Ovide Lotion should be determined by your healthcare provider. Always follow their instructions for the best results. Make sure to carefully read all the instructions in the product package before using Ovide Lotion. This medication is specifically for use on the hair and scalp and should not be swallowed. Be cautious to avoid contact with your nose, ears, mouth, vagina, or eyes. If the medication accidentally gets in your eyes, wash them with water immediately and speak to your doctor if irritation persists. Apply the lotion to dry hair and scalp, making sure to cover the back of the head and neck. Leave the medication on for 8 to 12 hours, then shampoo and rinse well. Use a fine-toothed comb to remove dead lice and eggs from wet hair. If lice are still present after 7 to 9 days, consult your doctor for further treatment. It's normal to feel a slight stinging sensation on the scalp, but if irritation occurs, wash the scalp and hair and consult your doctor. Lastly, be aware that this medication is flammable, so avoid smoking or being near open flames or heat sources while using Ovide Lotion. Some possible side effects of using Ovide Lotion include burning, stinging, dry hair, or a temporary increase in dandruff. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Ovide Lotion, make sure to inform your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have asthma, skin infections, psoriasis, eczema, or any open sores or wounds on the scalp. If you experience worsening redness or pus, notify your doctor immediately. If you are pregnant, only use this medication if necessary and discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using Ovide Lotion, it is important to be aware of any potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is recommended to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is important to not start, stop, or change the dosage of any medicines without the approval of your doctor. If someone accidentally swallows Ovide Lotion, it can be harmful. If the person has serious symptoms like passing out or having trouble breathing, it's important to call 911 or a poison control center right away. Symptoms of an overdose may include breathing problems, muscle weakness, shaking, increased sweating, increased urine, nausea, vomiting, diarrhea, anxiety, headache, confusion, dizziness, drowsiness, and slow or fast heartbeat. It's important to seek medical help immediately if an overdose occurs. When using Ovide Lotion, it's important to remember not to share this medication unless directed by your doctor. Normally, one application is sufficient. To prevent the spread of lice, make sure to wash all headwear, scarves, coats, and bed linens in hot water and dry them in a dryer at a high setting for at least 20 minutes. You can also dry clean them, seal them in a plastic bag for 2 weeks, or spray them with a disinfectant that kills lice. Additionally, Soak brushes and combs in hot water for 10 minutes, in alcohol for 1 hour, or throw them away. It's also important to thoroughly vacuum furniture and floors. If you are in close contact with someone who has lice, be sure to check for lice and nits and consider treatment to prevent infestation, even if live lice are not found on you. Ovide Lotion is used to treat head lice infestations. It works by paralyzing and killing the lice and their eggs. Follow the directions on the package for proper use of this medication. Typically, Ovide Lotion is applied to the hair and scalp, left on for a certain amount of time, and then rinsed off. It is usually applied in 1 or 2 treatments, about 7 days apart. This medication is for external use only. Avoid getting it in your eyes, nose, mouth, or on broken skin. Make sure to store Ovide Lotion at room temperature and away from any open flame. It's important to keep all medications out of reach of children and pets. When you no longer need the product or it has expired, make sure to dispose of it properly. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.